Following portion of Daytime Tri-Cities is sponsored by SFG Medicare.
Well, certainly it seems like everything today is costing more. On today's episode of Get Medicare Educated, we're going to talk about money-saving tips with your health insurance. Andrew Price with FSG Medicare is here now with more, and of course saving money right now on anything, Andrew, certainly sounds good.
Oh, yes.
And we are talking about saving money on our different plan when it comes to Medicare.
Yes, so people that have Medicare supplements tend to see the rates go up every year. So supplements are different from Advantage plans. Advantage plans are the package where you have all combined. A lot of those actually don't cost anything. The other type of Medicare plans are Medicare supplements or Medigap plans, and they get more expensive every year. And so it's very important that if you haven't shopped your Medicare supplement about every 3 years, you really need to, because you're probably throwing some money away that you could save otherwise.
What are some of the biggest ways then that you can save money when you're looking for those?
So Medicare supplements are actually all the same. So there are different plans, but the plans, whether it's with one company or another company, is the exact same thing. So it's all about price. So I always tell people, if you buy a soda at the gas station or you buy it at the grocery store, it's the same exact soda, but it's a different price. That's how the Medicare supplements are. And so what I do is I represent all the different plans and all the different companies, and so I shop for people to get them the best price. And it's the exact same plan, same benefits. It's a different company, but it gives you a lower price.
So how much are you talking about when it comes to the fluctuation of prices?
It can be pretty huge. I've seen people save over $100 a month, but usually it's around $50. So if you're paying over $150 for your Medicare supplement, you really need to shop it. I helped a couple in their 70s last week, and they each saved about $70, and that's a month. So that's a pretty big savings for the exact same plan that they were on.
Same benefits across the board.
Same benefits. And the best thing is, with a Medicare supplement, there's actually not an enrollment period. And so you don't have to wait till the fall like you do your drug plans or the Advantage plans. You can actually do those today. And what we do is, they do ask health questions, so you do have to qualify, but we'll set up for the first of the next month. So right now what we would do is we would set up for August, because we're about to come into July. And if you get approved, then we cancel your other one for August. That way you're not, a time period without a health insurance.
And speaking of health insurance, what about the dental side of things?
So Medicare supplements do not include the dental. They just cover the gaps in Medicare. And so in the past, we haven't had a really good dental or vision option. And I got contacted by one of the major carriers last week, and they have an amazing dental, vision, and hearing package. It's about $56 a month, but it gives you $5,000 worth of dental, vision, and hearing benefits. And so when we're comparing those, if you have a supplement, you're paying a high price, and you don't have those benefits, you could actually lower your price by getting the same plan and then use those savings to add your dental, vision, and hearing.
And you said $5,000?
$5,000 per year worth of benefits through this new dental, vision, and hearing plan.
And you said too, you represent lots of different ones, so you're able to really shop around. How can people get more information on these things that you've been talking about?
So everyone's situation's different, and so that's why I sit down with people one-on-one, and I look at your situation, look at your plan, and if there's an option available, then almost always I can help you, with that option. But the best way to get a hold of me is just through my cell phone. So I always carry my cell phone. People call me, they get me directly. They don't have to deal with, pushing all these numbers. If I don't answer my phone, leave me a message, and I usually call you back that same day.
All right, well, sounds like a lot changing too in the world, especially with dental options now too.
Oh, yes.
All right, we'll give everybody, as he mentioned, here is the information. You can get a hold of him on his cell phone, which is listed right there on your screen, 737-1865. You can also check out the website there for more information. Andrew, great to have you.
Thank you.
The preceding portion of Daytime Tri-Cities was sponsored by SFG Medicare.